So today we're going to go step by step over how to give yourself an injection with a Follistim pen for IVF. So if the nurse explained it and you panicked and everything went in one ear and out the other, do not worry. My name is Jess. I am a certified nurse midwife and nurse practitioner, and actually I also have 7 years of experience as a registered nurse, and I personally am going through IVF, and I can show you how to do it. So what you're going to need is your Follistim pen, a Follistim cartridge, and typically that comes with the needles you need to inject it in the box, a couple of alcohol pads, and something to dab blood with, whether that be gauze or a cotton ball or even just some paper towel is going to be fine. So I've already opened my Follistim pen, and it came with this case. So it's in this box. And to start, I'm going to pop the cap off and unscrew the two parts of the pen. And then I'm going to take my cartridge out of the box. And so this is what the cartridge looks like. And you just want to clean the top of it with an alcohol pad. And then you want to drop it into this yellow part of the pen, so the stopper is going to be coming out the other end. So see, there's the stopper coming out the other end, and then you're going to screw the other end of the pen on. And so you want to make sure the arrow is lined up with that yellow line. And then before I move on to the next part, I always like to clean off the area I'm going to use on my abdomen first, just because I feel like as soon as the needle gets on, usually medication starts leaking out right away. And you do want to see the medication leaking out of the tip of the pen, so that way you know it's properly loaded in the pen. But it makes me panic and feel like I'm like losing medication. And so I just try to give it to myself as quickly as possible after I have the needle attached to the pen. So typically for a subcutaneous injection, you're going to want to go on your abdomen, and usually a couple of inches away from your belly button. And you can see I've poked myself a few times already this week. So I'm just going to clean off a broad area. And then while that's drying, I'm going to peel off one of these needles. And that part is sharp, so you don't want to poke yourself. Place it on the cap and press hard and screw it on. And then there's two caps. And so you can already see there is a droplet of medication forming at the end of the caps, or at the end of the needle, so I know I have it on right. So now I'm going to dial up my dose. My dose is 225, and you want to make sure you don't go past your dose, because it's really hard to recorrect if you do that. And so now I'm just going to pinch that area. I'm going to do one quick motion in, and then I'm going to push all the way down until the plunger is all the way depressed. And then you want to count to 5 just to make sure all of that medication went in. And then I also like to let go just to make sure all the medication went in, and count to 5, and then pull it out and just apply some pressure. And then I also, again, because I start to panic that there's stuff leaking out, I like to get the needle off of it. Oop, gotta make sure it's pressed on all the way. Screw the needle off. Oh my gosh, come on. Sorry, okay, so my cap wasn't working. So I just want to get the needle off as quickly as possible, just because it does continue to leak medication. And with the way our plan is set up, I'm actually going to go back and use that at a later date. So I always save the remains, because it's 300 IU cartridges, and I only use 225 at a time. So, but then you can just put your pen back together. And then I put this all in the fridge since I'm saving that medication. But, you know, obviously do whatever you've been directed to do by your clinic. And so it's pretty simple. It's just a subcutaneous injection. So it's a really tiny needle. And since it's into your belly fat, it's really not painful. It's like a little pinch. So hopefully that was helpful. If you have questions, feel free to type them in the comments. I'm happy to answer them. Please double check all dosages with your IVF treatment plan, because the amount that my reproductive endocrinologist recommends for me might not be the amount that your reproductive endocrinologist recommends for you.